Welcome to the Kanter Health video series. The Lifetime Health Diary is a new, disruptive, innovative platform that gives patients sovereignty over their own health and healthcare. This company is called The Diary, and we are here today with Kirk Sanders, Chairman of the Board and Managing Director. Kirk, can you share with us a little of the interesting history about the Lifetime Diary from conception?
Yes, Danielle. The Lifetime Health Diary was invented over a decade ago in Japan when Hamish MacDonald, a young New Zealander who'd come to Japan to study martial arts when he was 19, started working with a Japanese doctor at Sushi Matsunaga, who is the 36th generational head of a 700-year-old medical practice in Osaka, Japan. And Dr. Matsunaga had known Hamish from a variety of different business experiences they had together. But one day Dr. Matsunaga explained to Hamish that he was very frustrated with his inability to understand holistically the conditions that his patients were presenting, and he wanted a more efficient way to understand their conditions so that he could actually diagnose what their causes of illnesses are and come up with better treatment plans rather than just giving drugs to symptoms. His family had been in the holistic Eastern medicine for over 600 years of their history, and all of his predecessors had known everything there was to know about their patients. How many dogs they had, did they live in a high-rise, were they farmers, how many children did they have, and he said in the Japanese modern healthcare system he had 6 minutes to diagnose a patient, come up with a treatment plan, and figure out what they should do next. And he said, I can't do the job the way my family has done it for 600 years, so let's figure out how to solve that problem. And what they ended up with was designing something they called at that time Aristotle, which was the predecessor of the Lifetime Health Diary.
Dr. Berwick's concept of the triple aim: better care for individuals, better health for populations, and reducing per capita costs. Give us some of the ways that the diary can help support these goals.
So, well, actually, there's two elements of that. One of the things that's great about Dr. Berwick's position is that we really can focus on holistic ways to decrease the cost of care while simultaneously improving outcomes, patient satisfaction, and population health. Part of the problem with that relates to the cost question is that every one of us is unique. And so population health is about statistics, and it's about evidence-based medicine, and if I'm unlucky enough to be that person that falls outside the standard, then I'm not going to get quality care because I'm getting evidence-based population health medicine as opposed to personalized or precision medicine, which could be more costly because what's wrong with me may not get caught because I'm just being treated like everybody else who's a 57-year-old white male. And so what we really need to do is take that population health kind of model, and then we need to personalize it so that when I get a test, it's based on my family history. If no man in my family's ever had prostate cancer, is there any reason why I should have a PSA test every year? If no woman in my family has ever had breast cancer, is there any reason why I should have a mammogram every year? We need to make sure that people know their numbers, that they get the appropriate age and gender screenings and preventative tests that are appropriate for them as a person, and then everyone needs to have a good relationship with a primary care team that really can help them manage their health. And if we do those things, and the diary enables that because we have all the information that someone needs to track and manage those things in one place, I think we can really impact cost from an information point of view. But it's our hypothesis that if people actually own and control their health information, they may take a little bit more interest and responsibility for their care. And if they do that, then there's a greater chance for them to avoid unnecessary tests, to improve their lifestyles, and generally have better outcomes, which typically means lower costs.
Can you tell us a little bit about your company's unique belief in individual rights and private property ownership of their health data?
So one of our founding principles as a company is that people should own and control their health. And the reason that becomes so important is almost every aspect of healthcare in the United States today is governed by contracts or agreements which essentially are imposed upon us as consumers. We don't even have the legal right to own the data that emanates from our body. So if there's a device that collects data about an illness that we have, that company can say, well, you're going to use our device, but you can't have any of the data that comes out of our device to manage your health. And we just don't think that that's right. So our belief is that we will actually improve health, we'll solve the triple aim that Dr. Berwick presented, we'll actually have the improved population health, we'll have better patient experience and outcomes, and we'll decrease cost if patients are empowered and engaged to own and control their health. And so sovereignty over that data is a very, very important part of our business concept going forward.
So the diary aspires to have global reach. You aspire to become a multilingual, multicultural platform. Can you tell us a little bit more about your global ambitions?
Yeah, that's something we're most excited about. We actually are a global company today. We have employees in Canada, South Africa, New Zealand, and the United States, and expect to expand that base all over the world. But since we were founded in Japan, we were originally programmed as a prototype in New Zealand. And so we really believe that having a diary which can capture and help people capture information in any language, any major language all over the world, will be a very large contribution, not only to personal health, but to public health. And because we're moving to a time of greater and greater medical tourism and more telemedicine, and there needs to be a platform where doctors across borders in different languages can communicate with patients or their caregivers, that without something like the diary, it's going to be very difficult to capture the maximum value that can come from things like telemedicine and medical tourism.
Every company sets a vision and a mission statement when they launch. As we know, finding the right employees, management, executives, and directors to match the compatibility and support these values in the work environment can be challenging. Your company has taken this to another step and another level. Your culture book caught my eye, and I read it all. I read it completely. Can you give us a background a little bit on how this golden book was established and how you started the culture?
Yeah, so Hamish McDonald, our CEO, is a very, very intelligent student of business and has probably wrote almost every business book ever written. And when he and I met, we talked about the kind of company we wanted to build. And one of our beliefs was that we wanted to build a company that was the best place that anyone had ever worked in their life. And we wanted to make a company that was very agile, that could move very quickly, that could solve problems in a way that companies can't typically solve because they're all top down. There's an idea that gets filtered through and everybody performs to some leadership team. We want a company that's constantly innovating internally, externally, where everybody's working in teams that are flexible and everybody's working toward this bigger vision for what the company should do, but they're bringing all of their energy and intelligence and they're bringing that to the team that they're on, and then that team is working toward this common goal. And we believe that the culture that we're trying to create should allow us to be the most effective company, that's the most competitive, that builds the best products, that has the best results, that has the best customer service, that treats everybody that we work with kindness and respect. And so that's the kind of company we wanted to build, and that's the kind of culture book. And Hamish is primarily responsible for that, plus all of the employees who contributed, because part of our participatory model is everybody gets to participate in designing our corporate culture, and knowing that it's iterative. It changes over time as our vision grows and people get more involved. It allows everybody to have a role to play.
The Joseph H. Kanter Family Foundation's mission is to realize a global-scale learning health system. In a learning health system, consenting patients' experiences are shared to enable learning, and these lessons learned are rapidly mobilized to empower better informed health decisions. How does the diary empower people to share their experiences so they learn from one another to improve overall health?
So Danielle, I think it's interesting because the value statements of the Joseph Kanter Family Foundation and the Diary Corporation are almost identical. I couldn't believe it when I looked at your website. And fundamentally, we believe, as the Diary Corporation, that people have sovereignty, ownership of their health information, and it should be treated like private property, like their house or their car, which is contrary to almost everything that happens in the healthcare system today, where all of the terms and conditions and privacy policies basically say, if I want to use this service or I want to go into this hospital, they can do anything they want with my data within the law, within HIPAA, and I can't negotiate those terms and conditions. So one of the things we want to do is help people get everything possible together from any source of health information, put it in the Lifetime Health Diary, and then allow them as private property owners of that data to share voluntarily that information on whatever basis they would choose. So that means that they could choose to donate it to research for charity purposes. They may want to sell it to pharmaceutical companies for their own benefit if they've got an illness that they want to get money to help support. We give them the power of control and the ability to have leverage to negotiate, because their data is very valuable for them to use. So if we can then, giving them consent because they own it, they can consent to whatever they want to do with their data. And our vision and goal is to create a community of people that want to share their data for not only their own benefit, for their family's benefit, but for the benefit of the community that they're participating in. And hopefully the net of that will generate very, very large amounts of data that can be used for scientific research to improve public health. And by giving people ownership, we really think that's the fundamental basis for people to donate and allow their data to be used for the kinds of research that the Joseph Kanter Family Foundation would like to support.